With this powerful tool at hand, we first set a pilot study to see if this works, mainly to obtain proof of concept that women actually can scan themselves without the physician present in the room with her and performing the examination. So women can scan themselves was the proof of concept was set out to perform. And as you can see here, this was published in Telemedicine and eHealth in 2022 by our team. Now, I want to take you through the pilot study itself. So this was an observational, non-interventional trial with 100 pregnant women at weeks between 14 and 40 weeks of gestation. Each participant was requested to scan at their own judgment at least once a day and up to 3 times a day for 7 to 10 days. That was it. 1 to 3 times a day for 7 to 10 days. Each scan lasts 3 minutes and is composed of 6 predetermined segments of scanning with a pre-scan animated video tutorial before each segment. So it can be easy for the patient to understand what she's supposed to do and how she's supposed to scan. Now, these 6 segments of each scan, we were basing that on a previously published and adopted 6-step standardized approach, which you can see the publication right here from 2014. So we based our 6-step scan to this paper. These are the 6 basic steps. Step 1, these were all aimed to ensure that all essential fetal parameters can be visualized. Now, the first one on the left side on the top is fetal presentation and lie. Second, fetal cardiac activity. Third, number of fetuses. 4, placenta location and position. 5, estimation of amniotic fluid volume. And 6 is biometry. Now, I have to say that this was not included in our pilot study and was replaced with the free scan without predetermined steps. So the part of the biometry was not completed. Accordingly, before each segment, an animated video tutorial that you can see here, you see how the patient can see the tutorial and understand what she's supposed to do in each step. And this was coupled with verbal guidance. Step 1 usually takes 15 seconds, steps 2 to 5 about 30-40 seconds, and step 6, as I said, was a free scan for the remainder of the time. Now you can see that the patient is moving the phone and the transducer in a way that she can see herself what she's scanning, and this was done according to this tutorial that you see right here. So, as I said, 100 women completed the trial. We had about, you can see, about 32 years old. Mean gestational age was 23, 24 weeks. They completed about 13 to 14 scans per each participant, with an average of between 1 to 2 scans per day, short scans per day. Each of the scans, as I said, includes all of the 5 steps that I talked about. In total, at the end of this pilot study, we had 1,360 scans in total that we were able to analyze. And when we analyzed them, each scan was reviewed independently by 2 sonographers or physicians. So each of the scans reviewed independently by 2 healthcare providers. These are pictures of some of the first scans included in this pilot study that I was talking about. Now let's take a look at the results of the pilot study. Look at this. We were able to detect fetal heart rate in over 95% of cases. We were able to see amniotic fluid volume. You see it on the 4th row from the top in about 92%, and fetal body movements in 88% of the scans. We detected with lesser success fetal tone and breathing movements. So we were very happy with the results. First time that you can prove that a woman can self-perform an ultrasound at home, and we can still see the fetal heart activity, body movements, amniotic fluid, etc.